Hey, this is Dr. Perry from Farmington Family Dental. I get a lot of questions about cleanings. When do I do them? How are they done? Let me answer some of those now. Oh, shucks, you probably heard deep cleaning, regular cleaning. It gets all a little bit confusing. Let me explain a little bit what a deep cleaning is. A deep cleaning is when we're going underneath the gums. If you've ever heard that phrase, getting long in the tooth, that's just a phrase that our ancestors used to use to describe losing bone in and around the teeth. And when we lose that bone or we get deep pocketing around our gums, that's when a deep cleaning is needed to clean out all the tartar, calculus, and just bacteria crap that builds up there. You'll notice with a deep cleaning, your breath will be better afterwards. It will go better for you as far as your bone and gum health afterwards as well. So someone asked me, what is a deep cleaning versus a regular cleaning? How do they compare? Okay, so a regular cleaning, you notice you go in to see your hygienist, it's great. She doesn't even poke you at all. She'll get off that tartar that sits mostly on that lower front area. There'll be a little bit of that roughness. Clean that right off and you'll be good to go. Usually takes like 5 to 15 minutes, depending on how sticky that tartar or calculus is, but pretty straightforward. We're really only cleaning up above the gums on a regular cleaning. Okay, let me compare to a deep cleaning. A deep cleaning, we're going underneath the gums on the root surface of the tooth. And that's the definition of a deep cleaning, is it's on the root surface. And with that deep cleaning, we usually need to go underneath the gums, and we usually need to use some amount of anesthetic to make it comfortable for you instead of uncomfortable. Takes a little bit more time, a little bit more finesse. And for a person who's coming first into our office, an adult, sometimes that's what we need to do, to get a deep cleaning done, and a couple of appointments, usually 2, we have the full mouth done and you're clean and set and ready to just maintain what we've cleaned. Okay, shoot. So why is this needed? Sometimes you go into the dentist and they give you that bill for the deep cleaning. Oh my gosh, deep cleaning, it's a big deal. But why is it needed? It is needed to restore you back to health. Until the bacteria underneath the gums are cleaned up and out, they'll continue producing toxins and poisons that are inside your mouth. Like, this is what you eat, and you breathe this stuff day in, day out. It's down underneath your gums. It needs to be cleaned out. The bacteria need to be cleaned off. The tartar that houses them needs to be cleaned off of the teeth, so that you can restore back to health the gums, and you can stop that bone loss that happens when you have tartar underneath the gums like that. So it's just to preserve your health. Okay, so how long can you go without a dental cleaning? Well, however long you want. Kind of like going between oil changes. About 30 to 60,000 miles down the road, something blows. That's expensive. Rather than doing dentistry like that, usually we see you about every 6 months or so, sometimes a little bit more frequently if we need you there more frequently to help you maintain your teeth and your smile. Let's talk pain. Oftentimes people ask me, well, is this going to hurt? A dental cleaning shouldn't really hurt much at all. And I say much because usually we do it without anesthetic, and we do make some measurements around the bone or around the gums for people who are older than about 18. Shouldn't hurt more than St. Patrick's Day celebration did last year. Might feel a little pinch, but that should be it. Overall, people walk out of an appointment like that and like, oh my gosh, it feels amazing. You'll feel like $1 million when you walk out. Okay, so teeth after a cleaning, they're going to feel different. That tartar that builds up, especially if it's really thick on that lower front, and there can be some other areas where it builds up on, when that is removed, it's like feeling that shiny, smooth, slick surface underneath. Kind of like washing your car. It's going to look different, but it should feel amazing afterwards. Okay, so how much does a dental cleaning cost? Good news, we have an in-house plan and we have a new patient special. Give our office a call, Farmington Family Dental, at 573-756-5760. We'll get you set up for what you need on your cleaning, get you healthy, and maintain your smile. Okay, so how do you keep that amazing feel you get after a dental cleaning? How do you do that at home? The best thing that I have is an electric toothbrush. Now, I'm a little bit agnostic on electric toothbrushes, but I do offer one here in the office that I think is one of the best, if not the best. What I'm looking for from a toothbrush for you. Electric all the way. Something that's battery, that's powered, that charges it. It doesn't have replaceable batteries. And it needs to have a pressure sensor on it. That pressure sensor ideally will tell you when you're pressing hard enough and too hard. And it needs to have a timer on it so you can see how long you brushed for. The best ones will even give you like a smiley face afterwards. Stupid as that sounds, like who needs a smiley face after they brush? But it feels amazing when you knew you did a great job at brushing and it tells you that, hey, you did a great job. We sell those toothbrushes here in our office that meet all of those wanted criteria from me. There are some all around. You can find any type, but that's probably the biggest thing you can do to keep that same delicious smile feeling that you have after a professional cleaning. So I hope I've been able to answer some of your questions about dental cleanings and how you maintain your teeth. Now, if you have any more questions, you're ready to come on and have it done, give us a call. We're at Farmington Family Dental. Our phone number is 573-756-5760. We look forward to seeing you.